Hello, this is Dr. Bates, and we're talking about Chapter 13. We're finishing up viruses, and now we're going to talk about some specific viruses, give you a concept of kind of what's out there and what kind of symptoms that they cause, what kind of diseases they cause. So the virus families, we break them into DNA and RNA viruses, and we're going to talk about the DNA viruses first. The first one up here is parvo, and you've all heard about parvo, and if I say parvo, you usually think of a canine infection, parvo in dogs. Now, there is a vaccination for parvo in dogs, and if you get a puppy, you should get a vaccination for the puppy because parvo is excreted in feces, the virus itself, in dogs that have been infected or passed the virus, and you will find it in soil. So it can last up to 2 years in the soil. Therefore, if dogs have ever been in the area where you take your dog, your puppy, it is likely that they could catch parvo, and 91% of dogs that catch parvo die if they haven't been vaccinated. The vaccine, of course, will prevent the parvo infection from spreading and causing its symptoms, which it causes an inflammation of the stomach and intestines. Not a very good way for your puppy to die, and very difficult. 91% who get it die. So you do want to give that vaccination to any puppy that you get. Fist disease is caused by parvovirus. It's a different virus, but it's fist disease, and it's called fist disease because it was considered the fifth classical childhood skin rash. So very common. In fact, it's thought that most people have actually had fist disease. You just don't ever get the symptoms. You've been infected with the virus and you passed it without having any of these symptoms, which are a red rash on your face and your hands. It begins as a respiratory infection, and its symptoms showing as the rash. Recovery is quick and normally without any complications. So it's just something that children get, like the chicken pox, which is also on this list a little lower down. Now, adenovirus is called that because it was isolated from the adenoids. It causes respiratory infections in humans, and you've heard of the common cold. Just as we have said before, if you get a virus, they cannot give you antibiotics to treat it. Now, some viruses can be treated with antiviral drugs, but many times it ends up with something simple like the common cold. An antiviral drug is not going to help you very much because by the time you take the antiviral drug, you're already fighting the infection and it just has to run its course. Now, for some things, if you take the antiviral drugs before you show symptoms, then it can stop the symptoms of cold, can take care of those. But in lots of cases, when you get a virus, the only thing we can do is actually treat you for the symptoms. To stop viruses, you need to get a vaccination. Now, adenovirus, there are viruses in there that are known to cause tumors in animals. Not cause tumors in humans, but that tells us something a little bit about it, the possibilities that we might find something further down the road. Now, papillomavirus, you've heard of this one before. It has the classifications of wart-causing viruses or tumor-causing viruses. So papillomavirus, or HPV, you've probably heard before, the human wart virus. It is a sexually transmitted virus, and in most individuals, in fact, in 70% of the individuals who catch this, they actually clear the infection in 1 year. 90% clears it in 2 years. But of the 5 to 10% that are unable to clear it on their own, they can end up with lesions on their cervix, which will cause a kind of a initiator or a little bit of a push that could eventually cause cancer. So the HPV vaccination is to stop you from getting, HPV, again, your body would normally clear it, but to stop those possibilities of cancer relating to the lesions that are caused on the cervix. The polyomavirus causes tumors and cancer. It is known to do this, which is why a concern in cancer research and in preventing possible cancer. Now, the poxviridae, those are called pox because they cause pus-filled lesions, and you've heard of smallpox and cowpox. We've already talked about those before. Herpes viridae. Herpes is called herpes because it's where you find the spreading cold sores. Chickenpox and shingles are caused by the same virus. Chickenpox infects gets into your nervous system, in your nerve cells. And so chickenpox actually is a respiratory. The chickenpox on your skin is the final stage of the infection. Children get chickenpox, not a big deal. There can be deaths from it, but those are a low possibility. But chickenpox causing those sores on your skin, the scratching that always occurs, and a childhood normality is what we kind of expected. We now do have vaccinations for chickenpox. You used to have chickenpox parties where your teacher would call your parents when your kid didn't show up, or your parents would call the teacher and say, you know, my kid has the chickenpox, and the teacher would say, oh, please bring them in, because we would rather have all the kids get chickenpox at once, deal with this and move on. So that's kind of how it was treated. The problem with chickenpox is what happens when you become an adult. Now, some adults who have never had chickenpox will get shingles whenever they get the virus that causes chickenpox as an adult, and it's a painful and horrible infection. And once it pops at once, it's likely under stress conditions that you could get shingles again. Now, it has been noticed that as we started giving chickenpox vaccinations, that there has been an increase in shingles. Now, whether that is correlated or not is not shown, but it is kind of interesting. It is also not known quite yet how long the chickenpox vaccination works and if it will continue to protect the individuals into later into life. We're still looking at those. But as an adult, you can get the chickenpox or shingles vaccination to help prevent or to let your system remember what chickenpox looked like and stop the infection. Now, if you have a light case of chickenpox, what happens is that virus is still part of you. And so later in life, if you become stressed and your immune system doesn't remember the chickenpox infection, then it can pop up and you can get shingles from that previous infection. So you can get shingles by getting chickenpox or getting the virus as an adult, or it can be because your immune system never developed the full immunity to the virus itself. Now, also in this group is Kaposi sarcoma. This virus causes cancer in immunosuppressed individuals. It is something we had never seen before until HIV/AIDS epidemic occurred, and Kaposi sarcoma showed up, and we found this virus that, if the immune system isn't working properly, can encourage cells to, well, overgrow. Down here we also have hepatitis. Hepatitis, it causes swelling, inflammation of the liver, and so the viruses that are in this group are going to cause those effects. And there are other things called hepatitis or cause hepatitis that are in other categories. In fact, if you overlook on the RNA, we have Hep B over there, hepatitis being the swelling of the inflammation of the liver. So now let's move on to the RNA viruses. And over on the RNA viruses, we have polio. And polio is a virus that affects the nerves and can cause partial or full paralysis and atrophy of the limbs. That's usually what you notice in individuals who have had polio. Now, polio is considered 99% eradicated in the world by the World Health Organization by vaccinations. There are still 3 countries where it is endemic, and they're having difficulties in actually eradicating it in those countries. Toga verde, they're called toga viruses because they're enveloped. They have a covering over them, hence the toga part. To go down to noroviruses, you may have heard of them before. If you've ever been on a cruise ship, norovirus becomes a very important thing. It happens to be a common virus, a common gastroenteritis infection causing, well, diarrhea and all those things that go along with that. And norovirus is common on cruise ships, like I said before. So if you ever plan on going on a cruise ship, you should actually check the CDC to determine whether that cruise ship has a good background in having a low rate of noroviruses, because noroviruses, well, they tend to spread in crowded conditions, and a cruise ship happens to have the perfect environment for the norovirus to be located and passed around individuals. Now, the next one is rabies, and you've heard of rabies before. We normally think of rabies as being the vicious rabies, but there's also dumb rabies, and that happens in organisms that are not normally predators. They can get rabies. Cows can get rabies, and when a cow gets rabies, she gets the dumb rabies, and that makes them just kind of stand around and not really move very much. Rabies causes, at the end, brain inflammation, and what it does is wherever you get bit, it passes through your nerve cells, your nervous system, to get to your central nervous system and to get to your brain, causing the effects that we see overall. If you develop any of the symptoms of rabies, which is salivating, it causes hydrophobia, you're actually scared of water, it causes a complete mentality change in the individual. They can either get the violent rabies or the dumb rabies, depending on the person, depending on the individual and the infection. If a person develops the symptoms of rabies, you will die. There's nothing we can do for you at this case. A dog has rabies and bites someone, they'll immediately start the individual on rabies drugs, antivirals, and if they start you before you get the symptoms on the antivirals, there's not a problem. In the United States, it's actually carried more likely by bats or skunks. If you're ever bitten by a bat, you want to go into the hospital immediately. Take the bat if you can, just you, and go through the rabies vaccinations. They are not painful. There used to be a horrible set of injections that you had to take. Nowadays, rabies vaccinations are not like that. We do not give everybody rabies vaccinations because the vaccination itself is not long lasting. If you're a vet, you will get the rabies shot. You have to get it every 6 months to be a vet. But if you do get bit, you want to go to the doctor, get the rabies vaccinations immediately to make sure that it doesn't spread and you don't develop the symptoms. Again, once you've developed the symptoms, you will die. There are 6 known cases of individuals surviving. 5 of the 6 did not survive in a very good fashion. One individual did, and she was sent through a set of hospital procedures. She was bitten by a bat, didn't know it, started developing the symptoms, went to the hospital. They actually chilled her body down, gave her antiviral drugs and several other drugs to try and fight it, and she was actually saved. There is a noticeable change in the way that she walks, but she was able to attend college and continue on with her life. Now, the catch is that they've tried to replicate her procedure with other individuals, and no one else has survived. Now, if you're going to be bit by a rabid dog, the question is, what is the best thing you can do? Because if you're going to be bit, you're going to be bit. The best thing that you can do if you're going to be bit by a rabid dog or a rabid animal is to offer them your foot. And that sounds kind of funny, but the rabies virus travels through your body, and it's actually not a very fast rate comparably, but it is fast, and so it travels inches to feet per day depending on where it's in your body. So if you're going to get bit, if you offer them your foot, you have the longest amount of time to fight the rabies before it actually causes the symptoms or gets to your brain. Now the next group is West Nile, which you've probably heard of, also a hepatitis C. West Nile, it causes flu-like symptoms. It is probably the worst flu you will ever get. It is originally from the Nile. It was brought over to the United States and noticed and now is a problem in the States. We worry about mosquitoes passing West Nile to you, your horses, or birds, and it can travel that way. Now we have SARS, which you've heard of before probably also. It caused quite a stir in China and concern that it would take over the whole world. It is an upper respiratory infection and so far has not produced the outcome that everyone was concerned of. Now the next one is Ebola, and you've all heard of Ebola before. Is hemorrhagic fever. You basically bleed from every orifice in your body. And right now, there's not much we can do to prevent it. It happens in Central West Africa, where it is endemic, and it is thought that it survives in bats, but it's not completely understood how it survives in the environment. Now we have the Rio Verde. These are respiratory enteric or orphan viruses. That's where the Rio came from, and it is respiratory intestinal tract infections. The next is influenza, and influenza, the flu, which we've all heard about. There are several different types of influenza, and influenza is very good at changing itself. In fact, you've probably gotten the flu shot this year, and the flu shot, people say, okay, well, I got the flu shot and I got the flu. Well, the way it works is that scientists, mathematicians, look at how the flu has traveled around the world. So this travels around the world, traveling through country to country, people to people, until it gets to us during our flu season. And so what happens is they watch what is the predominant flu version that's out there, and they pick that one, and they give the shot based on what they've seen. Now, if that's not the flu that made it here, then that's not the flu that you've been protected for. However, it has been shown that if you get the flu shot and it is the wrong flu, if you catch the flu then, you will have lightened symptoms compared to not getting the shot. And it's also thought that if you got last year's flu shot, that it still does provide some protection this year against the flu. Again, lessened symptoms. Now, some people say, I got the shot and I got the flu from the shot. shot. Well, that doesn't happen, and we'll talk a little bit about that later, but you can still get flu-like symptoms because remember, we are teaching your body what the flu looks like. So I'm giving you something that should induce your body to fight it. Now, we hope that the symptoms are light, that just your immune system has responded and interacted with it, taken it out, and is now on watch for the virus. But some people have a higher immune system response, and therefore they do get flu-like symptoms. Now the last one here is retrovirus. This is the group that has reverse transcriptase, and HIV is here. HIV is a very important problem that we have now, but nowadays we do have the ability to treat it, and most people who get HIV are able to live a long life. The problem with HIV, though, is that it causes your immune system to go away, and when your B cells and T cells no longer function, then you are susceptible to other things like Kaposi's sarcoma, and you will end up with other things that make you sick. So it's not the HIV in and of itself, it's the secondary infections that you end up with. Remember that retroviruses with the reverse transcriptase and HIV are capable of being latent viruses. They're capable of setting around in your system and causing an outbreak later on in life, which is what's caused HIV to be so easy to be spread, because people don't know that they have HIV and they spread it. Now, HIV, we consider it a sexually transmitted disease. However, it is a disease that must have blood-to-blood contact for you to have a high probability of getting it. Since it is a blood-to-blood contact, the reason that it's passed via sex and the reason it's high among homosexuals is the physicality of sex. The possibility of blood-to-blood contact is heightened in those cases. So this is a type of flu, but we call it H7N7, which describes what the virus looks like. So avian flu, lots of flu viruses, are carried in birds. And so the avian influenza and H3N3 virus that we have in humans happened because somehow an avian virus was transmitted to a pig along with the pig being infected with a pig virus and a human virus. All three of them at the same time. And the way viruses work, when the virus, if three viruses were able to infect one cell, then as those virus parts are being built, they actually get mixed up. And so you end up with a virus that gets genetic exchange between the three, and you end up with a new virus. And so this is how it's thought to be. The swine flu occurred, and other changes that we see to viruses. So it is a possibility that new viruses can be made when you get an exchange of information between viruses. Researchers converted skin cells into embryonic stem cells, and that is currently being done and researched for the possibility of using adult embryonic stem cells, adult cells that we have turned completely into those beginning cells. The way this one was done is they first inserted RNA that was complementary for 4 embryonic genes into a virus, and then that provirus was inserted genes into the skin cells' DNA. And the question is, what kind of virus could you use to change the genetic information in a human cell? Well, hopefully you know that there's actually a couple viruses could do this, but retroviruses would be a good example of a virus that could do this process. And it is thought that viruses themselves, with their ability to insert their genetic information into a cell, would be a way to do gene therapy or to help individuals or fix individuals' defects or their genetic defects by actually fixing their DNA so that they make whatever they're missing. All right, so we talked about the differences between a virus and a bacterium. We talked about the parts of the virus, the taxonomy, isolation and how to grow them, talked about the virus cycles, mentioned viruses in cancer, talked about the difference between latent and persistent, and then talked about those prions, viroids. Finally, what I just presented here, which was virus families that infect humans. Do make sure that you understand the parts of a virus, that you understand how you grow them and how they actually do the infection. So it's very important to understand the difference between a DNA and RNA virus, and that it's the way viruses work is what makes them difficult for us to treat or cure you of. All right, that's the end of the lecture. Good luck.